So welcome to our Healthier Together Lunch and Learn. Well, it's not lunch and learn, it's twilight session actually. We changed it from a lunch and learn to twilight to be able to get school staff engaged as well. So this one's a focus on back to school. And it was really a look at kind of what are the key issues and challenges around childhood illnesses when children go back to school, and give some support and advice as how parents can be supported. So I'm just going to do an outline of the session around, we'll be covering a bit of an introduction to the network for those who may not be aware, and then a reminder about Healthier Together. Alex will be looking through preschool, early term checks, can my child go to school, common conditions, give a bit of a summary, and then we'll do a Q&A session at the end. So just to give a bit of context from a Child Health and Wellbeing Network, I think everybody will be aware of all the challenges that we have as a region in relation to our children and young people and the poor health outcomes that they are at risk of, and we know that we have a lot to do to improve those outcomes for children and young people. A lot of poverty and a lot of families living in poverty, which adds that extra challenge to those families to be able to improve their health and well-being. So part of the work that we do around Healthier Together is to support a reduction in A&E attendances, because actually we have the highest in the country for children aged 0 to 5. So it's really about reducing those pressures as well, supporting our healthcare system, but also trying to support our families to make those informed choices to navigate the healthcare system as well through the role of the Healthier Together website and mobile app. This just obviously gives you some of that overview of some of the statistics and some of those challenges that we have. From a network perspective, the network was established in 2018. We have a very much a shared vision that was brought together by professionals and children, young people and families, and it's very much that we believe all children and young people should be given the opportunity to flourish and reach their potential and be advantaged by organisations working together. And as a network, that's part of a lot of the work that we do is around sharing models of good practice, working with wider partners to develop those models and test and learn from them. You can see there on the right hand side our priority wheel, and that's very much about the priorities we have and the shared priorities that professionals and children and young people put at the forefront of what they wanted us to work on. So you can see there'll be no surprises to you there: mental health, poverty, additional needs and vulnerability, inequalities and access, strong start in life, mental health, childhood illnesses, health promotion, and as a result of COVID, when we went back out to the system, family support was one, and there was a lot of our families needing that additional wider family support as a result of COVID. So as a system, what was the ask? It was very much about sharing good practice, drive work forward and connect us to expert groups. Part of the reach and delivery, we do a lot of work around comms and communication. As you can see there, we've got a lot of work ongoing constantly around the Child Health Tuesday bulletin and trying to share the work widely through our network huddles and a lot of the things we do with young people through our youth board and things like Twitter Takeover Day. As a network, we have responsibility for programmes of work around the Children and Young People's Transformation Programme, with a lot of my colleague Louise, who leads on a lot of work around asthma, epilepsy, transitions, and works with the Diabetes Network closely on diabetes. As part of the work that I oversee is the integration pilot, and that encompasses the work of the Healthier Together work that we're obviously sharing today. A lot of work around tackling inequalities and Core 20+5 as part of our remit. So that just gives you a flavour. At the end of the slides and presentation, if you're not a member, you can sign up to the network and receive a lot of our information and bulletins as part of the wider offer that we have. So I'm going to hand you back to Alex, who's going to take you through the session on the back to school and childhood illnesses.
Thanks, Laura. So it's great to see some different professionals represented in the audience, so thank you for that. I hope that some of this will be relevant to all of you. There'll be a bit of a mix of what I talk about, but my aim is to take you through a bit of a reminder about what Healthier Together is, which I hope isn't new to anyone. Talk, as Laura said, about some of the preschool things or what we can think about at the start of term, because it's a great opportunity to really try and get things sorted and in order for the year ahead, but also think about things about common advice about can my child go to school, and also think about some of the common conditions which occur and we know that occur in most schools, and just think about an approach to some of those so that everyone's got confidence doing that. Thanks, Laura. So most of you should be familiar with the Healthier Together website and their mobile app. And this is obviously, this presentation will predominantly be focusing on the website. And if we go on to the next slide, you'll hopefully all be familiar with our traffic light system. So this provides us with a red, amber and green, depending on how worried we should be. And for some of those conditions, I'll take you through some of the specifics, but otherwise I'll guide us towards where to find information. Next slide. As Laura has kind of already alluded to, our website provides information for professionals and for parents, and also some information about referral pathways. And I think one of the highlights of it is the fact that it is completely transparent. So the information is available for everyone. So particularly when we come to talk about the Can My Child Going to School, hopefully it'll be particularly a useful resource for parents and schools alike, so that we know that we're all kind of singing from the same hymn sheet. Next slide. So one of the first things that's great to see in the audience, there's quite a lot of public health nurses, I think, to think about is vaccinations. And this is a really important topic, particularly as we start going into winter. So we know that winter will focus on, there'll be a lot of respiratory infections, and that tends to be one of the main causes of children being unwell, and also children missing school. So some of the things that we can do around that are encouraging children to take their seasonal flu vaccine. Now, some of this may be around in school, and some of it may be through primary care, but it's about providing parents with information about that, and there's information on our website about the flu vaccine. But also, it's also the opportunity to think about whether or not children have had all their vaccinations. Particularly pertinent to this is the need for making sure that people are up to date with things like pertussis and measles. We know that in the northeast currently we have had both whooping cough and measles, and these have been relatively well publicised. Some of the reason that people miss vaccinations, as we probably all know, isn't necessarily vaccine hesitancy, but is also perhaps because during the pandemic they may have missed appointments. So the start of term just really presents us with that opportunity to check in with parents and make sure that if they have missed any vaccinations, they can get their children vaccinated. Probably the most important page is this page, and this is the most important page for parents, for schools, and it's all derived from NHS England. So it should be the same information wherever you go to seek advice about whether or not your child can go to school. And I think this is probably the real take-home message for everyone, is you can see there that again it's got kind of information about which conditions you can go to school with, and they are the green ones. It's also got information about where they may or may not be well enough, or where there might be slightly more specific indications as to whether or not you can go to school, and then the red ones are where you should stay off school. And this information is available on the website to parents and to schools. And what you might remember from the website is that each page that is available on the website you can send via an SMS text message. So this page can be shared with whoever you need to share it with. And I would encourage everyone to look at it in a bit more detail and make sure that they're familiar with it. And also, I'd be interested if anyone who works in a school where they feel that their local policy would be discrepant to this, if you let us know, we'd be really interested to have that discussion. Next slide, Laura, thanks. So one of the things I wanted to think about today, particularly at the start of term, and remembering that some children may have changed schools and transitioned to a different school, is to think about known conditions. And I think if you think about all conditions in this kind of format, it'll help everyone just make sure that we've covered all the aspects we need to think about. So the first thing is to identify what the condition is. And that's not just a responsibility of the school, but that's actually making sure that the child knows what their condition is. And that may not be the in-depth knowledge of it, but knowing whether or not they have any medical problems. Making sure that the parents have shared any relevant information, and making sure that school are aware of conditions which may affect a child at school. Coming on to that again, the next thing is to know what those triggers are. And that's particularly important when we're thinking about things like asthma and allergy. And I'll talk about those in a bit more detail later on. And then the next part of known conditions is for the child, young person, parents, and where appropriate school to know about the specific treatments. For some of those treatments, it will be about knowing what their emergency treatments are, and that may be the most important thing for schools to be aware of. What do children need to have access to, and what is their emergency treatment? But also, if we have any interaction with parents and children and young people, knowing what their regular treatment is that may prevent the need for an emergency treatment is also really important. And for some children, they may require medication during the day, and that's another important aspect of this. So the next thing I was going to talk about in a bit more detail is asthma, because I think that's probably one of the biggest problems that we have, not just in the Northeast, but in the nation as a whole, and it's worth its own mention. So if we go on to the next slide, we know that asthma management is split into preventative medication and emergency treatment. We also know from our own experience that sometimes families can get a bit confused as to what they need to do, and I think sometimes being aware of what that is can help really keep this condition under control. Forgive me for those of you that know this already, but the preventative medication is the medicine that the children or young person need to take every day to try and reduce their frequency of attacks, so asthma attacks, or frequency of need for emergency treatment. For some children, they'll have a simple inhaler for their preventative medication that they should take every day, and it's about making sure that they know that they have to take that every day. And the majority of this responsibility comes from the healthcare professional looking after them. That may be primary care, secondary care, it may be nurse-led or doctor-led, but knowing that that is to be taken every day. And then the second part of the treatment is what to do in an emergency. And this is probably particularly relevant to schools. And that's a bit more that we'll focus on about their emergency treatment. So what should we do in an emergency? When we're thinking about an emergency management, the first thing we need to know is how to recognise those signs. So we'll come on to that in a moment. So what are the signs that this child needs their emergency treatment? And that should be, again, that the child and young person should be able to recognise when they need that. The parents should be able to explain when they may need that. But actually, it's really important for any staff member that they can see some of those signs and they can recognise when a child may need their emergency treatment. What do you actually practically need to do? Probably there needs to be, and this will depend on how old the child is, they need to be able to support the child with access to their reliever inhalers. So that may take some careful planning depending on how big the school is. So where do they keep that inhaler? How are they able to access it? And these are discussions that should start at the start of term to make sure that everyone is aware of what to do. The third part falls onto the healthcare professionals. So this will either be primary or secondary care, that every child should have an asthma management plan. And this is personalised to the child as to what to look out for, what to do with their treatment, and when they need to escalate to get more help. And we're pretty good at doing that in the region now. We've got a bit better, but it's really important that if there is a child who doesn't have an asthma management plan, that is flagged so that their professional looking after them can help support that. All of the asthma management plans are available on either through the Healthier Together website or to the Beat Asthma website, which I'll come on to as well. And that should be, there are general ones there as well, but children should have their own specific ones. Historically, we used to just write a letter to support this, but now there's a much clearer standardized format in which we can support children and young people to make sure that they know what to do and where to seek help. Next slide, thanks. So sorry, this hasn't come out very well, but if you look on the website, you'll see it in much more detail about these are the red signs. So the red signs are the signs that should make you concerned and means that actually this child needs to get medical help. And these are things such as too breathless to talk or eat or drink. They may even have gone blue. Hopefully they won't have deteriorated this quickly, but these are the things that you're looking out for. It will also give you guidance on how often you can give that inhaler, and that you should continue giving their inhaler until they are seen by a doctor. People worry about doing this in my experience, but actually it is better to keep treating them until they're seen, and then they can be transferred to a place of definitive care. The next slide, I think, should show you what the amber signs are. Yes, good, they do. And these are the signs where actually, hopefully, this is when things will be picked up. So this shows you that the child is getting slightly more unwell, and that they're at the point where they need some treatment. And again, their personal asthma plan should highlight these symptoms as well. But for ease, and for maybe for children who perhaps haven't got it with them, or perhaps it's not easily accessible, despite everyone's best efforts, the amber signs will show you how to assess in simple terms and when to be concerned and what treatment to start. And I think that though they have been these signs have been looked at nationally, and hopefully they're really clear as to what to do. So the information that you need, and I would encourage everyone to look at these pages in particular, because on both Beat Asthma and on the Healthier Together information about acute asthma, there is information for parents and professionals, and there's actually also a separate information section for school. And some of this information can be really helpful and can help guide, particularly when thinking about exercise, after school clubs, going away on trips, about information that can be printed if that's easier, but also saved and stored for individual children. If we go on to the next slide, I'm just going to briefly mention what we often call viral induced wheeze. This usually is a condition which affects younger children, typically up to the age of 5, so less for the school age children, but I think it's important to mention it, as some children who have a blue inhaler may not have a formal diagnosis of asthma. Most children with a blue inhaler should still have a wheeze management plan, and they are very similar to the asthma management plans. It's just slightly different in the terminology. The signs that they demonstrate will be virtually identical to a child who's suffering from asthma, and I think it's important that people recognise that whilst they may not have a formal diagnosis of asthma, they may have the same symptoms and should be treated in the same way, and that those conditions and information are also available on the website, but that it's important that even without a diagnosis of asthma, if they have an inhaler and a tendency to wheeze, that treatment pathway is considered. Next slide. So the next thing I wanted to talk about is allergies, and I think this is probably something that over the past few years has become increasingly important and increasingly stressful in some circumstances as well. But again, I think we can think about allergies in different ways. And that is into avoiding, identifying and treating, and we'll talk about those as we go through. I have just noticed a question on the chat, and I'll come back to that, Michaela, in 1 second. We'll just finish the allergies section if that's okay. Go for it, Laura. So the first thing to know about is avoiding allergens. And I think it's really important, again, that it comes down to education and knowledge. Does the child and young person know what they're allergic to? Do the appropriate staff know what they're allergic to, and are they aware? Some of this is also not just about knowing the name of it, but also knowing what that food looks like. And we had a little project that was done in our outpatients a few years ago about trying to ask children what children attending the allergy clinic, what nuts they were allergic to, and the majority of them could tell you the words, but then when shown with the pictures of what those nuts looked like, not all of them could identify which ones they were allergic to. So it's just really important that we use terms that children understand as well, so that they know what they're allergic to and they know what they should be avoiding. And I know that schools have taken this really on board, but I think it's just important making sure that we empower the young people and parents to have that conversation before they go back to school, so that they know what they're allergic to. Next slide. So then it's thinking about what are the symptoms of allergy, and these are again important and can be slightly different depending on the child. Again, all children with a known allergy who's been seen in secondary care should have an allergy management plan, and this will explain to them what their features are. Some children may actually never have had a severe allergic reaction and may know that they're allergic to something, so even they may not recognize the signs. The signs that I think most of us are familiar with are the signs of more severe reactions such as anaphylaxis, so problems with breathing, with wheeze, with rash, with lip swelling. But the signs that are sometimes less recognised, and we know that this is nationally, are things like tummy pain and vomiting, and more abdominal allergy. Most children Any children who has a known allergy should have a plan, and again, they should have their emergency management available to them. Again, I think at the start of term, it's a really important thing to think about if a child has an adrenaline auto-injector or an EpiPen, where is that stored? Who's got access to it? How is it going to get there if the child has a reaction? And if they have more, they may have different treatments. Again, they may have antihistamine or salbutamol, but it's about thinking about where are those stored and when is that child likely to need them, and who is going to be responsible for getting them, and how are they accessed. So that's the part of you of identifying the symptoms and then initiating treatment. If we go on to the next slide. So this is just looking at those symptoms in written format, and again, this is the information that's available on Healthier Together, and we know that those symptoms are, as we mentioned, for the older child, they may be able to explain what it feels like, that they feel like they've got a tightness in their chest or their throat. They may have obvious swelling, they may be breathing faster, they may also go quite quiet, and that's why it can be tricky. They may make just sort of noisy breathing noises, or they may just look like they're persistently coughing and unable to get that. They may also become pale or blue, and that's when an emergency ambulance should be called. And if we go on to the next sign, this is, I think, most of the things that I have talked about, but it's really important that these features are considered. So what is that child's treatment? Do they know where, have their treatment with them, or do they know where it's kept? Who can access it? And have you got their up-to-date allergy management plan? And do they know what they're allergic to? The question in the chat was regarding salbutamol and inhalers and about spacers. We recommend that spacers are always used. This is with any of the inhalers. So for the majority of children, they will have a spacer and an inhaler, and they should have an age and size appropriate spacer to match their inhaler. There are some inhalers where children have struggled with remembering to take a spacer or using a spacer, and this is particularly in the teenagers where they have a modified approach where they don't need a spacer, and these are more these are slightly different inhalers, and it should be directed. But the allergy management plan should state if they need a spacer, and they should have a spacer and an inhaler at school and with them. So I hope that answers that. And in answer to Charlotte, yes, we can certainly send you a copy of a viral wheeze plan. Next slide, please. So yes, so in the same way as that there's plenty of information available for asthma, we've got a really great resource, particularly that was established in the North East, which is beta anaphylaxis. And here you will find, again, not just the information for parents and professionals, but sections about school and advice about that, and printable and downloadable information. And then we also have information on Healthy Together, which is available at the website there. Another thing that is, I think it's worth considering, is bronchiolitis. Now, bronchiolitis, many of you will have heard of or may have had children with, and it's a really common respiratory infection, particularly in the winter. We know that it's typically caused by RSV and other viruses, and it's commonest in the under 2 years. But actually, we know that increasingly older children are presenting with symptoms. Generally, the symptoms of this are cold-like symptoms associated with breathing difficulties and a cough, and the cough can persist for really quite a long time, including up to sort of 2 or 3 weeks after the initial infection. The little ones can be affected with difficulty feeding, and children generally get worse for the first 3, 4, 5 days of illness, and then start to get better. There isn't really any specific treatment, and they will generally get better on their own, but it is a very common reason for having coughs and colds in the winter. The reason it's got a lot of coverage this year, and you may have seen stuff in the information, is that they are starting a vaccination program in pregnancy, and the idea of that is that by vaccinating pregnant mums, you may protect the youngest population when the babies are born during winter by maternal passing of antibodies to the baby. And so that's quite an exciting development, which may hopefully reduce how much trouble we get to with bronchiolitis. If we go on to the next slide, for those of you who are seeing kind of younger children, you'll know that this is the particularly important things for babies with bronchiolitis, and it's usually related to how fast they're breathing and whether or not they're even having pauses. Sometimes if they're having a kind of a grunting noise, or particularly really harsh noises with their breathing, or if they're becoming pale, then they should be advised to go to the nearest hospital. And on the next slide, for those of you who are making professional assessments, probably in the primary care setting, there's guidance on when to escalate patients with bronchiolitis and when you are able to reassure. On our website, there's also information supporting families as to providing information about the duration of bronchiolitis, symptoms, and what they can do at home. And unfortunately, the answer is that it's one of those things that gets better with time. So we've talked about quite a lot of the kind of very medical things, thinking about asthma, allergy, and bronchiolitis, but probably one of the biggest issues presenting for children going back to school is sleep. And I think it's really important just to take a moment to think about poor sleep, partly because we know that sleep is a really important part of general health and staying well, and it's potentially something which, as healthcare professionals and probably as people at school, we get asked a lot about. So if we go on to the next slide. So we know that poor sleep is important for a number of reasons. It can result in some physical symptoms, so things like headache and tiredness and fatigue. It can obviously affect concentration, which is always a problem at school, and it can be the result of underlying problems. So if you've got particularly large tonsils and you're snoring, that can be reflected in poor sleep. We also know that during the school holidays, sometimes children and young people, probably more the teenagers, can get particularly out of routine, and this can cause real issues when going back to school and being asked to try and get back into the habit of getting up earlier, having perhaps spent the summer staying up a lot later, which, as we know, fits much more with the teenage brain, but now being asked to get up at 7 o'clock to get to school on time. So if we go to the next slide. So I think a lot of this is really well known by everyone in the virtual room, but it's important that we think about it at this time of year. So we know that sleeping, ideally, children and young people should have a quiet environment where there are lights off, smoke-free. Perhaps one of the biggest things is that we should advise them about screen time, and perhaps we should all take this advice ourselves. You should avoid it in the hour before bedtime, and that's particularly associated with the phone because the light coming off the phone stimulates the brain. Ideally, children shouldn't be having screens in their bedroom, particularly to help them with better sleep. And they also need to have the opportunity to get plenty of natural light during the day. As we're moving into a time when the natural light during the day is going to get shorter and shorter, it's particularly important that children are able to access this light. Some of the other things, and we'll come on to this again a little bit later, is that anxious children, sleep can really be a problem. And I think we are increasingly aware that this is an issue for a lot of young people and children, and asking parents and family members to support children with this and allow them the opportunity to talk if they're worried about, or write down concerns, that can start a conversation with children and their parents as to what it is that's particularly making them anxious and stopping them from getting to sleep. It's also important, and this is easier said than done, but to be consistent with the limits and rules that have been laid down at home, because it allows children to have that safe time when they're going to switch off and be allowed to go to sleep, and enforcing things like screen time limits and all those issues which we know are important in sleep. If you go on to the next slide, one of my colleagues has written a real wealth of information about healthy sleep, and this is something we often send out to parents and children and young people. And this page is a really useful one. It's probably one of the pages that I use the most in Healthy Together. It's got information about sleep for families regarding all ages, and also a guidance and advice about how much sleep children and young people should be getting depending on their age. It also gives slightly more detail about the tips that I've mentioned in the previous slide, and about sleep hygiene. And I think it's a good resource to recommend to people and ask them to work through, because we know that if people work through these resources with their children and young people, the majority of children will get back into a better routine and will be able to get functional, good sleep, and that can make, as we all know, a massive difference to their daytime working. So the next thing I just wanted to touch on is anxiety. And I put this picture in because actually when you go into PowerPoint and you search pictures for anxiety, this is what comes up. I'm not really sure what this pig has got to be particularly anxious about, but I thought he was quite sweet. So I thought it was quite a nice little picture to have as for anxiety. But I think anxiety is increased again is one of these things that we are certainly in paediatrics seeing more and more, and it manifests in different ways depending on the child. I think what's also really important is that many children, particularly in the slightly older age group, can manifest anxiety through physical symptoms. And certainly in general pediatrics, we see a lot of children who have anxiety, which presents as things like headaches and abdominal pain and even vomiting. And I think what's really important is trying to work with children, young people, and education in trying to manage those symptoms, but also not excluding them from school, because we know that actually by stopping them from going to school, that can really impact and not make the anxiety better, but can in fact exacerbate things. And I think sometimes this can be a particular problem with children who have things like headache and vomiting, where actually the usual response for the first time would be to send the child home or ask them to stay off school, whereas actually what they probably need is the encouragement to come back to school and to be able to have a brief time out, but to go back into classes to try and manage those symptoms. And I think part of the importance there from primary and secondary care is that communication as to what the symptoms that the child is suffering from are related to. Next slide. There's a lot of information out there about anxiety, and I think one of the things we've tried to pull together in this anxiety page on the information on the website is normalizing that feeling of nervousness. And I think the beginning of school term is a real natural time for children to feel anxious and worried. And I think if we can manage and support children through those initial stages, it can be really helpful and help the child improve to get through that initial period. What we've pulled together on this page is a bit of information about what anxiety is. As I mentioned, trying to normalize some of it, but then also some tips of things about how to offer support to children and young people about what to do with those feelings, and also when to recognize when it's becoming a significant problem, and hopefully some guidance as to when you need to seek professional medical help. There is also a whole section on crisis, so what to do when your child feels you're in crisis. And I think this is another really important area to try and address for the children and young people. So that's actually all I was going to say. And given that actually I think there's a sort of quite a nice number of people here, I'm quite happy to open it up to questions if people have got questions or any specific things they want to talk about. Yep, I can see a hand from
Yeah,
Nigel.
it's Nigel, yeah.
Hi, everyone. Good afternoon. Can you guys hear me?
Yeah.
Yeah.
Yeah, brilliant. Thank you. So I've actually tried signposting a few parents to the Healthier Together service a few times because I work in different GP practices. And often if it's medically related, I often signpost them to the GP. But I think in regards to this, when I've tried, I suppose, selling Healthier Together to them, I've had sort of trouble framing it in a way that would make it convenient for them.
Okay.
So for things such as any particular conditions that their children has, I try to kind of show them, if you will, on the website, in what way could it be useful to them. So I've mentioned, as far as I'm aware, on the app, they can create profiles of their children in terms of what health conditions they've got, so they can monitor it, and then, of course, use the traffic light system to signpost them to the correct service. I don't know if there are any Healthier Together champions amongst you, if that is the term, or anyone who's just used to selling it to people. But what would you guys advise on the best way to promote this to parents?
Yeah, so I think I tend to use it around specific interactions, so probably in a similar way to what you've highlighted, so that they come. So I often see them in the emergency department, and then use it as my safety netting tool. I also have used some of the kind of I use the sleep page a lot and send it to them, but that's usually after a specific conversation. I don't know if Laura wants to come in and talk a bit more about the work that some of the champions did.
Yeah, so I think it do like Alex said, it's a bit like using the making every contact count approach in that kind of when it's appropriate, because sometimes I think it's got to be appropriate to that parent of when it's usable as well. So like Alex said, if they're having that discussion about sleep, the SMS share button is a great way because you can text the page direct to the parent on the website. So if you're having that conversation, or if you're sending them home, say because the baby's had a temperature, but you want to give them a bit of safety net. And so you're just giving the parent kind of a gentle hand holding in relation to accessing it, because actually what you're saying is if you go home and your child's symptoms change, you've got the page there, you can check the symptoms again so you know what to do. So it's kind of having that more a kind of useful conversation, I guess, than just saying, oh, this is a great resource. Because actually, sometimes I think what we find with parents is if it's not appropriate at that time, they won't use it. But if when it is appropriate, they will. So a lot of our champions have been, supporting families where the child may have been unwell and they've had a conversation. So then they've said to the parent, oh, well, there's this resource you can use. Have a look through and chat it through. The schools have been supporting using it around school attendance. So we've got some lovely case studies where actually families are keeping their children off school for kind of minor childhood illnesses, but they've actually shown them that they can be in school for things like coughs and colds, as long as there's no temperature, it's not, COVID related. So I guess it's just how it's delivered and whether it's at the time appropriate to that parent, because actually sometimes, parents do say we get bombarded by different information. So, but when it's relevant and you need it, you're more likely to use it.
And I think it's also important, isn't it, about thinking about behaviours and like where parents seek information, and probably just repetition, and kind of going actually, so that you hope that the next time they've got a question about something, they would go directly to it. We try and use it as when there are particular important public health messages. So when there was the measles outbreak and the group A strep outbreak, we put a lot of information around it on that at that time on the homepage. So I think we try to use it in a topical way so that it's kind of the go-to place. But I think equally we're open to suggestions about if you've got kind of good ideas or things that you have worked for you,
Yeah, I think
or
as
things that
well.
are missing as well.
Yeah,
Sorry,
and one thing just to reiterate with the app, I think the challenge we've had as a region is we've been quite slow in the uptake from a primary care perspective. Where it's working really well down in other areas is that it's really embedded into practice. So it's, if a parent rings the telephone line, there's a reminder that Healthier Together's there to check your child's symptoms. It's kind of a conversation that's had, and actually, we've got some of the feedback from some of the practices in the other areas of the country that are using it is that they would never not go back now, because actually what they're getting through is the appropriate children to be seen because parents are using it effectively. So I guess, we're still kind of pushing this forward and it's quite new, so it does take a bit of a time to embed, and it's that communication so parents see it time and time again. Yeah. Is that okay, Nigel?
Yeah, no, of
Yeah.
course. Of course, if there's like a topic that would
Yeah.
make it relevant to, I suppose, segue into the Healthier Together
Yeah.
service, that makes sense.
Do you
Yeah,
want us,
thank you.
have you seen the SMS share on the actual website?
Until
No,
now, I didn't know that
right.
was an
I'll
yeah,
bring the pic. I'll bring.
when Laura shows you, it's actually really obvious, but I know lots of people that haven't
Don't
seen it,
realise.
and it is probably the most helpful. I think some practices from a primary care perspective have sent it to people like
So,
if they have consent to send text messages, so you can send the whole page. We have also had people who sent like the little we have the little orange book on the homepage, so if that's another way of sending it sort of proactively, you can send them a link to the little orange book.
if you can see at the top of the page here, there's SMS share. So I'm not a robot, and if I put your mobile number now, or any mobile number, that would just send a link to the website or any page that you're on. So if you're on, say, the sleep page, you can send that to the parent's phone. So basically, they get that information and that link there and then, and it's not coming from your phone, it's coming from the website. So there's no your mobile number or anything's not seen, it's none of your details. We don't, obviously it's stored in line with GDPR. There's no kind of information we get. We just know how many text messages have been sent, so the parents' details aren't used for anything. So it's a great way to say to them, obviously it's, it's just a free way of getting that information out to the parents at any time. So if you sat with a parent, you're having that conversation, but then they can read it at their own time, and they're more likely to use it in that way once they kind of use it once and realize that it has benefit to them.
And I think the SMS share is probably one of my favorite features, because I think historically as doctors we used to send out like pages of leaflets and stuff with letters, or give them discharge, give leaflets in A&E, whereas actually this is just much more readily available, and just much more practical and environmentally better, isn't it? And then I'm sure a lot of the leaflets we used to give out used to just stay in the handbag of whoever had presented.
Has anybody else got any questions that they'd like to ask Alex? Any other topics we might not have covered today? Or we've got Joni.
Hi there. I work for Durham County Council, so one of my roles is to kind of promote health and inclusion of children. And I've had a few schools and earlier settings that have been asked a question by health professionals of, are you a one poo school or a two poo school? And it links to diarrhea and vomiting and how many times a children has had a loose stool. But I always thought it was just the 48-hour rule regardless.
That's what I
or
thought.
I just wasn't sure on that one.
I'm fascinated by that, and I've never heard that, but I think that's very interesting. But I thought it was sort of 48 hours of symptoms. But I mean, it's tricky, isn't it? Because you could get into the minutiae as to when symptoms stop and start, but I always thought it was 48 hours.
Yeah. It is. It's from the last kind of symptom of diarrhea or vomiting. So 48 hours from when the child last had that. So that's the guidance, and really that's what comes down from DFE as well. So I guess it's about how do we get that out to schools consistently. That and sometimes as well, it's the works the other way, because schools want children back in because attendance issues, but actually they're then creating a bigger issue because it goes through the school like it's so quick, isn't it, to take hold sickness and diarrhea. So by putting that 48-hour rule, it's really about protecting other children as well, and I guess it's how we make sure that consistent message is there. So more than happy, we've got those pages, and we've got a lot of champion schools now across the northeast, trusts that have getting involved, and they're using it. So I'm just in the middle of collating all the data that they've shared with us, because one of the asks was that they kind of give us pre and post attendance data of when they start to use it, bits of case studies where they've worked with families to support them when they're just keeping them off with kind of the kind of common childhood illnesses, and actually they could probably be in school sometimes. But yeah, so I'm more than happy to be able to have some contact with you after this, if there's a way we can kind of support you in getting the information out, and maybe having that kind of joined up approach in sharing it wider with more schools.
That would be great. Yeah, I have to say,
I'm very interested.
One success for our local authority, we work really closely with a pharmacist, and we do a session, and it's around medical conditions mainly, but with a little bit of a short-term illness on. And we've encouraged majority of our Durham schools now to accept the over-the-counter medications, which I see you've got on your website.
That's brilliant.
So they're not chasing GPs to get a prescription. And we've talked about Think Pharmacy and all of those schemes, so that schools are pushing, and it's really helped their attendance as well. So again, we've used case studies and we've got champions who will say it's really improved our attendance. And the other one is, we've got schools, a huge number of our schools now, who will hold their own paracetamol and get consent from the parents, and then a conversation, so that they don't have to go home if they're not not well. So there are two big wins, but
Yeah, that
D&V is
is
just a bit of a
But
tricky one still.
But I think
I
those
can say that I've experienced that. My daughter goes to County Durham Skills, so I've had that conversation where the Brangan said, "Can I give her some paracetamol?" I'm like, "Yeah, of course you
but
can. She can stay at school.
I
There's
think
nothing wrong with that."
I think they're massive wins, and I think
Yeah.
that's fantastic. And I think the diarrhea and vomiting probably just needs a bit of pragmatic, similar approach, doesn't it?
Yeah.
But I think those are really two great wins. So well done.
So
Thank
is it
you.
that we maybe need to do a focus session on diarrhea and vomiting?
So actually, I've just come off a call about sort of virology about diarrhea. So actually, Laura, it's on my list of things. So I think that's
Okay.
good. That can be September's joy. Hand washing.
October's hand washing
Yeah,
and diarrhea and
October.
vomiting.
Hand washing,
October.
diarrhea, vomiting. Yeah.
Lovely.
Thank you.
Has anybody else got any questions? Any other topics that might be that you've got some asks around, or illnesses that we maybe haven't covered today? But we will be running other winter sessions on kind of individual subjects as well. So
Diarrhea
it'd
and
be
vomiting.
great to get, diarrhea and vomit will be definitely top of the list now. And great if you've got contacts where we can get more schools involved. Obviously, we do try to push it out through our contacts, but it'd be great to get more schools on board and supporting the push of the resource, because it is a great resource for parents. We've got Harriet's got a question.
Yes, I suppose quite often we have children coming in. I have two nurseries, so they tend to be around 2 years old, that they might have like a little rash here or there, and the parents ask us, "Oh, what do you think about this rash?" And obviously, most of the time, it's just our guessing game. I say, go to your pharmacy to get it checked out. Is that the right thing to do? Should I be offering them any more advice?
So I think that's a really good question. I think rashes is something that everyone hates, is the honest answer, unless you're a dermatologist, and then they love them. And I think Pharmacy First is a really good example then, because I think what you want is essentially the things that we worry about, aren't they, are life-threatening rashes with things like meningococcal, and there are pictures and things like that available on the website for that. Chickenpox, which actually frequently people don't know what it looks like, and particularly early on it can be quite difficult to establish. As anyone who's seen chickenpox will know, we've all been wrong before, but I think pharmacy is a really great place for that in the first instance. And then obviously there's always the concern about measles, but in my experience the majority of rashes are are not worrying. So I think Pharmacy First is a really good idea, and I think most of pharmacy would be happy with that, with the support that's available from things like Healthier Together and DermNet is other great skin resource as well.
And should I still be allowing that? Some cases we say, "Oh, we'll keep an eye on it for the next couple of hours," or should I just say, "Actually, can you go straight to the pharmacy?"
I think that's really tricky. I think it probably depends on the context of the child. I think fever and rash is it probably it depends on your comfort zone. I think some rashes that you see, the rashes that you see the majority of the time that look like the viral rashes when you're just not very well, I would happily keep. Rashes where you've got uncertainty, you probably need to be a bit more cautious, and it probably also depends on kind of the immunization status of the child. So the younger the child, the more worried I'm likely to be. The older the child, the less worried I am.
Okay, thank you.
And
Is that
obviously, encouraging the parents to download the app if you're in nursery age. It's a great resource for parents of that age. And there is the rashes lozenge there, so it gives them that kind of reassurance of what they're seeing. And like Alex said, if they've got a temperature, then realistically, if they've got a temperature, they shouldn't be in nursery. They should be seeking out medical advice for the child in relation to the age appropriateness, as well as per the guidance on the website and the app. So I think it's just keep reassuring parents to kind of use it as a trusted resource, because then they'll start to get used to using it. And I think that's the biggest challenge, isn't it?
I'll definitely be promoting the app and website.
I've just put the link into the rashes section of the website, which just gives you a little bit of more information. And then there's also a link for the NHS website for pictures of kind of common skin rashes as well. And that's quite a nice resource. But everyone hates rashes.
Thank you.
Any other questions or any comments? No, we're all quiet. So thank you very much for coming along. The recording will be uploaded, and we will be doing some future sessions. Obviously, there is some sessions out now. We've got another one of these sessions coming up in the 24th of September. We've got our asthma and epilepsy sessions being delivered by the asthma teams and the epilepsy clinical leads as part of the network. So there's some great sessions happening. If you put in the chat if there's any topics you would like us to cover, please let us know so we can actually put more sessions on. Isabel, you've got your hand up.
Hello, just making sure I'm off mute.
That's all right.
It's been really useful, thank you. I know you said it's been uploaded, but that just be onto this website, the Healthier
So it'll be
Together
onto the website. Yeah, I'll share the slides and I will obviously put the upload link as well to the once it's uploaded, I'll send the slides and the link to where it is on the website.
Brilliant, that's great. Just for colleagues, that's all.
Yeah, no problem. It'll probably be uploaded by tomorrow because I'll have to ask my colleague Anne to be able to get it uploaded onto the website because I'm not technically savvy enough to do it. But yeah,
Thank you.
But if you want to put in the chat any other sessions you would like us to cover, we will try and accommodate. We've had some other stuff because we did a session on oral health just before the summer, which we're going to redo because that was really well received and people said they would like that session again. There was more people interested in that session who couldn't attend at that time, so that will be something we'll be putting on as well. Okay, thank you. Fab, thank you, Joni. I'll drop you an email as well if you want to put it in the chat around maybe if there's some links we can do around getting it out to the schools.